Welcome to the deep dive.
Great to be here.
Today, we're really digging into a pretty tough health issue for our pets. We're talking about protein-losing enteropathy.
Yep, PLE is definitely complex.
Okay, let's unpack this. We've got a key piece here from a veterinary text focusing specifically on PLE in dogs and cats.
And our goal really is to pull out the crucial bits for you. What is PLE? Why is it such a challenge? What should you look out for?
Exactly. How it's diagnosed, what treatment involves, distilling it all down.
Let's get into it.
Absolutely. So first things first, what exactly is protein-losing enteropathy? What's going on inside the gut?
Right, so think about the gut normally. There's always a tiny, tiny bit of protein that leaks out just naturally. The body usually digests that protein and absorbs it right back. It's a normal process.
Okay, a little bit of leakage is fine, managed. So what tips it over into being PLE?
In PLE, that normal tiny leak becomes, well, it becomes excessive. You're losing way too much protein straight into the GI tract.
And why does that happen?
It's usually down to one of two things. Either the gut lining itself, the mucosa, is diseased and leaky, or there's a problem with the lymphatic system in the gut wall, causing increased leakage of lymph fluid, which is also packed with protein into the gut.
Gotcha. And is it specific proteins they lose, or?
No, and that's a key point. With PLE, pets lose both major types of blood proteins, albumin and globulin. Albumin is really important. The liver makes it, and it's vital for keeping fluid inside the blood vessels. Vets call it oncotic pressure.
Oncotic pressure, right, like a sponge keeping water in the bloodstream. Does the liver try to sort of make up for the loss?
Oh, it definitely tries. It ramps up albumin production, but there's a ceiling. The text mentions it can maybe double its normal output, roughly. But if the gut is losing coating faster than the liver can possibly make it.
And the levels drop, hypoproteinemia.
Exactly. And that's when you start seeing the big problems.
The visible signs.
Yeah. When that hypoproteinemia gets severe, the oncotic pressure tanks. The fluid doesn't stay in the blood vessels anymore. It leaks out.
Leaks out where?
Into body cavities. So you get ascites that's fluid building up in the belly, or pleural effusion, fluid around the lungs and the chest cavity. Sometimes, though less often, you might see swelling in the legs too, peripheral edema.
Wow. So it starts in the gut, but really messes with fluid balance everywhere else. Now, you said both albumin and globulin are lost. Is it always both? Like a drop across the board?
Usually, yes. That's called panhypoproteinemia, low everything. But the source makes a point that sometimes you see low albumin, but the globulin levels are actually normal, or maybe just low normal.
Huh. Does that difference tell you anything?
It can sometimes offer clues about the underlying cause, which is really the name of the game in figuring out PLE. I'll definitely circle back to that.
Okay, good nuance. So a gut problem with system-wide fallout. What other systems does the source say get impacted by losing all this protein?
Right. Proteins do so much, losing them causes trouble elsewhere. A really critical one is blood clotting, the coagulation system.
How does that work?
Well, pets with PLE lose a protein called antithrombin. Its job is to prevent clots. So if you lose antithrombin,
You become more prone to clotting, hypercoagulable.
exactly. It seems counterintuitive with leaky vessels, but yeah, they're at higher risk for dangerous blood clots.
Wow.
Okay, what else? Well, obviously the GI system itself is involved. That's where it starts. So you often see things like diarrhea, maybe some vomiting, though apparently not always.
Right.
Then you have the fluid balance issues. We talked about the hemodynamic effects, the ascites, the pleural effusion, making them look bloated or struggle to breathe.
And the lymph system?
Yep, the lymphatic system is often involved, especially with one common cause called lymphangiectasia, which is basically diseased lymph vessels in the gut.
Plus breathing problems from the chest fluid, and maybe even skin swelling?
You got it. Dyspnea, if there's pleural effusion, and sometimes that subcutaneous edema, the swelling under the skin, particularly if the protein levels are really, really low.
Okay, so yeah, a leaky gut protein problem can definitely ripple outwards. Who gets this? Any specific breeds or risk factors?
It can affect both dogs and cats. Any age, really. The actual number of cases, the incidence or prevalence, isn't truly known. And interestingly, even a bad bout of acute gastroenteritis can sometimes cause a temporary protein loss that resolves.
But the source mentions some specific breeds. Are they just more likely to get PLE itself?
Not exactly. It's more that certain breeds seem predisposed to the underlying diseases that lead to PLE. There might be a hereditary link for those primary conditions in breeds, like the soft-coated Wheaten Terrier, the Basenji, Yorkshire Terrier, and the Norwegian Lundehund.
Ah, so they're at higher risk because the causes of PLE are more common in them. Makes sense.
Precisely. And the main risk factors overall are just having one of those underlying issues. A chronic gut disease, a lymphatic problem, or even something like congestive heart failure, which can affect gut lymphatics.
Right, the root cause is everything. So let's talk about what an owner might actually notice. The signs are apparently pretty variable.
Oh, definitely. The most common things people report are chronic diarrhea could be ongoing, could come and go, watery, mushy plus weight loss, and just being lethargic, kind of typical sick pet signs, really.
Yeah, sounds like general gut upset. But there are some curveballs here, right?
Yes. This is where it gets tricky. The text points out that a surprising number of dogs with confirmed PLE actually have totally normal bowel movements.
No diarrhea, really.
Yeah. And maybe even more surprising for a gut issue, vomiting is apparently uncommon.
That is weird. I'd assume major gut leakage would mean vomiting and diarrhea.
Right. And here's another one that can really throw people off.
Oh.
Some dogs present because the owner thinks they're gaining weight or their belly just looks bitter.
Uh-oh.
And that apparent weight gain or swollen abdomen might be the only sign they show at first.
Because it's not wheat, it's the ascites, the fluid buildup from the lost protein.
Wow.
What about on a vet's physical exam?
The vet might feel that fluid in the belly, the ascites, or see the swelling in the limbs, the edema. If there's fluid in the chest, they might notice the pet having trouble breathing, the dyspnea. When feeling the belly, sometimes they could feel thickened loops of bowel.
Sometimes.
Yeah, the source notes that often, especially with that common cause lymphangiectasia, the bowel loops might feel totally normal.
Okay, so the signs can be subtle or confusing, and the exam often picks up the consequences more than the gut issue itself. This really leads to the big question. If PLE is the result, not the disease, what actually causes it? This sounds like the really interesting part.
Totally. This is where the detective work really starts. PLE is a symptom, right? A sign that something else is wrong. The causes are super diverse, but you can kind of lump them together based on how they make the protein leak out.
Okay, lay out the categories for us.
So first up, you have disorders of the lymphatics, problems with the drainage system in the gut wall. The classic one is intestinal lymphangiectasia. Those tiny lymph vessels are dilated, leaky, kind of boggy. Other things in this group could be cancer infiltrating the lymphatics, like lymphoma or certain types of chronic inflammation, granulomatous disease clogging things up, and, maybe surprisingly, severe congestive heart failure can actually cause back pressure, leading to lymphatic hypertension in the gut, making them leak.
Wow, even heart failure. So anything messing with lymph flow. What's the other main category?
The second big group is diseases causing increased mucosal permeability or ulceration. Basically, the gut lining itself is damaged or has holes in it, letting protein escape.
And what kinds of things fall under that umbrella?
Oh, loads of things. Infections are a big one. Certain viruses like parvo, bacteria like salmonella, even fungal infections like histoplasmosis.
Ah, histo.
Yeah, and quick note on histo, sometimes with that causing PLE, the globulin protein level might be normal or even high.
Why is that?
Because the body is mounting this huge immune response to the fungus, which cranks up globulin production, kind of masking the loss into the gut.
Interesting. What else causes leaky mucosa?
Inflammatory conditions like IBD, inflammatory bowel disease, different types, lymphocytic, eosinophilic. Also, adverse food reactions, allergies or intolerances can really damage the gut lining over time.
Okay, inflammation, food issues. What about physical problems?
Yep. Mechanical stuff too, like a chronic intussusception where the bowel telescopes on itself, or even just a chronic foreign body causing irritation and damage. And then, unfortunately, cancer, intestinal lymphoma again, or adenocarcinoma. Even simple stomach or intestinal ulcers can be culprits.
Goodness, that list is huge. Infections, inflammation, food, lymphatics, cancer, heart failure, physical blockages. It really drives home that finding the why is crucial. So how on earth do you diagnose PLE and pinpoint the specific cause from that massive list? That's the big question, right? How do you figure it out?
Exactly. It's definitely a process. Step one always is making sure the low protein you're seeing is actually from the gut and not something else entirely.
Yeah.
And looking at the pattern albumin versus globulin is really helpful here.
How do those patterns point you in the right direction?
Well, for example, if the liver's failing, the liver makes albumin. Remember, you'd usually see low albumin, but the globulins might be normal or even high. Plus, other liver tests would likely be off.
Okay.
Or if the protein's being lost through the kidneys, that's protein-losing nephropathy, PLN.
Yeah.
You also tend to see low albumin with normal or high globulins. You check that with a urine test, the urine protein-creatinine ratio. It'll be high in PLN, but should be normal in PLE.
What about blood loss?
Severe blood loss. Yeah, they can drop both albumin and globulin, kind of like PLE.
Yeah.
But usually, you'd see other signs, like anemia on the blood count, or maybe find evidence of bleeding somewhere, perhaps with a fecal occult blood test, and just plain starvation causing low protein. Very, very rare.
So what's a classic pattern for PLE then?
The classic textbook pattern is low albumin and low globulin at panhypoproteinemia. But remember that nuance. Sometimes, especially if the underlying cause involves a lot of chronic inflammation or immune stimulation, like certain types of IBD or that specific disease in Purkinje's, the globulins might stay normal or even go up because the body's making so much antibody.
Okay, so the pattern gives strong clues but isn't always perfectly clear-cut. How do you actually confirm the protein is leaking into the gut specifically?
Ah, right. For confirmation, there's a really specific test, measuring fecal alpha-1 protease inhibitor concentration.
Alpha-1 protease inhibitor. Sounds fancy. What is it? Why check for it in feces?
It's the protein that's normally in the blood plasma. The key thing is it's about the same size as albumin. So if albumin is leaking into the gut, this stuff leaks too. But here's the clever part. Unlike albumin and globulin, which get broken down by digestive enzymes in the gut, alpha-1 protease inhibitor is resistant to digestion.
So if it shows up in the stool. Yeah.
It means it had to have leaked in from the bloodstream and passed through intact. Finding high levels in the feces is pretty much definitive proof of excessive protein loss into the GI tract.
That is clever. Is it an easy test to run?
Well, the source is quite specific. You need a species-specific test for it, and apparently it's only available through one particular lab, the GI lab at Texas A&M University. And you have to collect samples from 3 consecutive bowel movements using special tubes they provide. So it requires a bit of planning.
Okay, so that test nails the PLE diagnosis. Then you start hunting for the specific cause from that long list we talked about.
Precisely. Once PLE is confirmed, or you have a very high suspicion based on ruling out other things, the investigation into the why really kicks off. And that involves a whole battery of tests.
Like what?
Starting with the basics. Multiple fecal exams looking for parasites, flotations, smears, the works. Blood tests beyond just protein checking serum cobalamin, B12, and folate levels is really important. Low levels can signal severe small intestinal disease or bacterial imbalances, which are common buddies with PLE.
Right.
Your routine blood panel, the CBC in chemistry, might show other hints too, like low calcium or low cholesterol, sometimes seen with fat malabsorption in lymphangiectasia, or maybe low lymphocytes, which can also point towards lymphatic issues.
What about looking inside? Imaging.
Imaging is huge. Chest x-rays first, maybe, to check the heart, look for signs of fungal disease. Abdominal x-rays could show if there's a blockage, like a foreign object.
Ultrasound.
Abdominal ultrasound is incredibly valuable. Lets you look closely at the layers of the intestinal wall, measure thickness, check for masses, look for those mechanical problems again.
Any specific ultrasound signs for PLE causes?
Yes. The sort highlights one for lymphangiectasia. Sometimes you can see these bright, white, sort of stripy lines within the gut wall. They call it a hyperechoic linear or tiger stripe pattern. That's from the dilated, fluid-filled lymphatic vessels. Really cool finding when you see it. And of course, an echocardiogram, a heart ultrasound if heart disease is on the list.
Tiger stripes. Vivid image. Okay, so imaging helps a lot. What if you need to get even closer or get actual tissue samples?
Right, then you move into procedures. Sometimes you might start with treatment trials first, like giving a broad-spectrum dewormer just in case it's parasites, or trying a strict elimination diet with a novel or hydrolyzed protein to see if a food reaction is the culprit. Quick and relatively non-invasive ways to rule things out.
Makes sense.
If you're in an area where histo is common, maybe a rectal scraping for cytology. But often, you need more. Endoscopy is a major tool, putting a camera down the throat into the stomach and upper intestine, or up the other end into the colon.
What can you see with endoscopy?
You could directly visualize the mucosal lining, look for inflammation, ulcers, irregularities, and specifically for lymphangiectasia, the source mentions you might see these little white specks or plaques on the surface. Those are the swollen lymphatics.
And you can take biopsies.
Critically, yes. Endoscopy lets you grab tiny tissue samples biopsies. The source stresses that getting good, deep biopsies, ideally full mucosal thickness, is really important. Sometimes superficial pinch biopsies can miss the disease lurking deeper in the gut wall.
So getting a good bite is key.
Often, yes. And if endoscopy is impossible or doesn't give the answer, sometimes the next step is an abdominal exploratory surgery.
Going in surgically.
Yeah. It allows the surgeon to directly look at and feel the intestines, see those dilated lymphatics if they're present, and get really good full-thickness biopsies of both the intestine and nearby lymph nodes for the pathologist.
And a pathologist looks at those
It
biopsies.
tells you what the underlying disease process is, IBD, lymphangiectasia, lymphoma, whatever it might be. They're not diagnosing PLE on the biopsy, they're diagnosing the cause of the PLE.
Got it. Confirm the leak, then use everything from fecals to surgery to find the reason. Okay, that's a complex diagnostic path. What about treatment then? How do you manage this?
Well, this is probably the most important point. There's no single drug, no specific therapy that just stops the protein leak in PLE itself. Treatment has to focus on the underlying cause you just worked so hard to find.
So fix the root problem and the PLE should get better.
That's the goal. If you can successfully treat the IBD, or the infection, or manage the lymphangiectasia, then the protein loss should decrease or resolve.
What if you can't fix the underlying cause? Or if the pet is really sick from the protein loss itself?
Right. Then you shift gears to supportive care, managing the immediate life-threatening consequences. That means trying to boost the protein levels and improve that oncotic pressure. Things like plasma transfusions or giving synthetic colloids like hitostarch or dextrin can help temporarily pull fluid back into the vessels.
Managing the fluid buildup.
Exactly. You might also need to physically drain the fluid if it's causing problems of abdominocentesis to drain the belly, or thoracentesis for fluid in the chest, especially if it's making it hard to breathe.
Is exercise okay?
Generally, yeah, normal activity is fine unless they're really debilitated.
And diet seems like it would be critical.
Oh, hugely important, especially if lymphangiectasia is the cause, or even suspected. Since the lymphatics handle fat absorption, the cornerstone of treatment is an ultra-low-fat diet. The target mentioned is less than 25% of the calories coming from fat.
That's quite low.
It is. The idea is to reduce the flow and pressure in those diseased lymphatics. In really severe cases, they might even need a special elemental diet, where nutrients are basically pre-digested.
Okay. Are there any medications used even if they don't fix the leak itself?
Yes, absolutely. Remember that hypercoagulability risk? The increased chance of blood clots because they lose antithrombin.
Yeah, that sounded serious.
It is. So addressing that is crucial. The source strongly recommends using medications to prevent platelets from clumping together, platelet aggregation inhibitors.
Like what? Aspirin?
Low-dose aspirin is one option in dogs, yeah. The text gives a specific dose, 0.5 milligram a kilogram twice daily, and even how to make a solution for accurate dosing. The other main one is clopidogrel, that's Plavix. Doses are mentioned for both dogs and cats.
Any catches with using those?
Definitely. You absolutely should not use aspirin and clopidogrel together. Increases bleeding risk too much. Clopidogrel can also interact with other drugs like NSAIDs or some diuretics or seizure meds, and of course both increase the risk of bleeding, which is a big concern if the pet needs surgery or even just has ulcers already.
Makes sense. What about diuretics, those water pills, to help with the fluid?
They're sometimes tried, like furosemide or spironolactone, to help reduce the edema or effusions. But the text points out they often don't work that well, because the core problem is the low oncotic pressure holding fluid in, not too much fluid overall. And they can risk dehydration or messing up electrolytes.
And any other medication mentions?
There's a brief mention of anecdotal reports using a drug called octreotide, but it stresses there are no proper clinical trials yet showing if it actually helps PLE, so more experimental at this stage.
It really sounds like this takes a huge commitment from the owner.
It really, really does. Educating the client is paramount. They need to understand this is likely a long-term, potentially lifelong condition requiring ongoing management, monitoring, special diets, medications. Spontaneous cures are, unfortunately, rare.
And you mentioned surgery earlier for diagnosis, but is surgery risky if they have PLE?
Yes, that's a major consideration. Low blood protein levels significantly impair wound healing, so any surgery carries a higher risk of complications, like incisions not healing well or breaking down.
But sometimes you have to do surgery.
Exactly. If the underlying cause is something like an intestinal blockage or a tumor that needs removal, surgery might be the only option, despite the risks. It's a definite balancing act.
Okay, so considering all the diagnostic maze, the challenging treatments, the underlying causes being variable, what's the outlook? What's the prognosis generally like?
Generally, it's guarded. That's the term vets often use. It really, really hinges on the specific underlying cause and whether or not that cause can be effectively treated or managed.
And often it can't be.
Unfortunately, as the source notes, in many cases, the primary disease causing the PLE just isn't curable. So you're managing symptoms and consequences long-term.
Is there any factor that might suggest a better outlook?
Well, there's a small suggestion that smaller breed dogs might do a bit better. The thinking, perhaps, is that it's just physically easier to provide the intense nutritional support they often need. Getting enough calories into a smaller body might be more achievable.
Ah, that makes practical sense. So if you get a diagnosis, ongoing monitoring is obviously going to be key.
Absolutely essential. It's not a diagnose and fix it situation usually. It requires regular check-ins, monitoring body weight closely, tracking those serum albumin levels to see if they're stabilizing or improving with treatment, and constantly watching for any return of the clinical signs, the belly fluid, the chest fluid, the edema.
How often?
Depends on how severe things are and how they're responding. Could be frequent at first, then maybe spaced out. And keeping tabs on those vitamin levels too, like cobalamin, especially if they needed supplementation initially.
And what are the big complications vets and owners need to watch out for down the line?
The text mentions a few main ones. Severe protein-calorie malnutrition, basically wasting away because the gut just can't absorb enough nutrients. Respiratory distress, if that pleural effusion comes back or gets worse, and just intractable diarrhea that becomes really difficult or impossible to control.
It paints a really clear, though definitely challenging picture of what living with and managing PLE
Yeah,
involves.
it requires a very dedicated owner and a strong partnership with the vet team.
So wrapping this up, what does all this mean for you listening? We've taken a real deep dive into protein-losing enteropathy today. We've seen how this condition, where the gut leaks excessive protein, can cause these major knock-on effects throughout the body, fluid accumulation, even blood clots.
And we've learned that PLE itself isn't usually the primary disease. It's a consequence, a signpost pointing toward a whole range of potential underlying issues: IBD, infections, lymphatic problems, food reactions, cancer, even heart disease. It's quite the list.
The diagnostic journey is fascinating too, isn't it? First, figuring out the protein is being lost into the gut, often using those albumin and globulin patterns in that specific fecal test, and then deploying all those other tools, imaging, endoscopy, biopsies, to hunt down the actual root cause.
Right. And the treatment reflects that. There's no single cure for the protein leak itself. It's
Yeah.
all about identifying and tackling that underlying disease if possible, and critically, managing those serious side effects, especially that hypercoagulability risk.
This deep dive really underscores how incredibly interconnected everything is. How a problem with nutrient handling in the gut can impact something as fundamental as fluid balance body-wide, or even how the blood clots.
It's a perfect example of that systemic connection, yeah.
So, for you thinking about this, maybe you're a vet tech, a vet student, or perhaps even an owner whose pet is facing this. Here's something to really mull over. Given that spontaneous cures are rare and many underlying causes are chronic or untreatable, how does understanding this guarded prognosis and the intense long-term management required factor into the really difficult decisions owners have to make about treatment paths, quality of life, and the emotional journey involved?
That's a really important question extending beyond the pure science of it. It touches on the human side of veterinary medicine.
Definitely something to think about. Thanks for joining us for this deep dive.
Thanks for having me.